Well, I am so excited to be in conversation with you, and I'm going to jump right in.
Let's go.
So, Dr. Joya, why is it so important that we have a dedicated Black Maternal Health Week? What does this week make visible that often goes overlooked for the rest of the year?
It was so exciting for us when, under the Biden administration, they made a proclamation to make it an actual national real week. Like we have Black History Month, there's an official White House designated Black Maternal Health Week. We had been, the founders of the Black Mamas Matter Alliance created this week back in 6 to 10 years ago. I honestly don't remember how long ago it was now, but we were doing it just among ourselves, and we would have events, and we would highlight midwifery and doulas and all the great work that Black birth workers were doing in mental health care services, and people like Shades of Blue, just so many great folks, and it got the attention of the White House. And so we knew we were doing something good when we could actually move the big institution. And that says that we could also get media coverage. So we've done everything from spots on, the morning TV shows. And the more that we can highlight the fact that Black women are 3 to 4 times more likely to die in childbirth within a year of their having a baby than their white counterparts, despite income or education, we're hoping that that will lead to actually more money going into the field. But at least right now, it's leading to more visibility and more conversations so we can decrease the harm.
Well, I mean, I'm so glad that we have a week like this, but of course, we would love to not have to have
I say.
a week, but definitely really important work. So, you already talked about some of those realities, but can we dig a little bit different, or excuse me, deeper? I mean, what should people really understand about the realities of Black women? What are we facing before, during, and after childbirth?
Yeah, for sure. I mean, I think when we started this process, my organization, the National Birth Equity Collaborative, is now in our 11th year. And I'm an OBGYN, and 11 years ago, I have to admit that I didn't know that Black women were dying in childbirth at 3 to 4 times the rate of their white counterparts. They don't teach us that even in medical school or residency. It's something as a practicing physician I didn't know. So that challenge of, despite our income and despite our education and despite where we live, Black women move to fancy neighborhoods and fancy condos and gated communities, and they're still like Serena, like Beyonce, no matter how fancy and famous you are, you're more likely to still be treated poorly when you come into the hospital. So the United States treats women poorly, and then you add Black skin onto being a woman, and that's why you get the poor outcomes. And before pregnancy, we're least likely to have jobs that have insurance tied to them. And so most of our jobs in America is how we get our private insurance, and it's really through your job. And so we are more likely to have jobs that don't cover us, so we're more likely not to have access to care before getting pregnant. We're also more likely to have insurance that is underinsured with higher co-pays, and so we're less likely to have access to some of the things people get, like access to breastfeeding services. We're also more likely to go back to work. People who are lower resource in the United States go back to work within 14 days of having a baby because we do not provide for paid leave like every other high income nation in the world. And so we are just set up to do poorly. We are set up to have pregnancy anxiety. We're set up to have higher rates of domestic abuse because our partners are having to deal with their having lower access to resource, and now a new baby and the stress of that. And it's just the conflation of being devalued, both as a Black person and a woman, creates these outcomes.
I understand it. And so I love that you mentioned, you can be Serena, you can be Beyonce, but that is no exception
Okay.
to, some of these deeply troubling cases where, Black women in active labor are waiting in pain, not being listened to, even with family being there with you, advocating for them. And so we're talking about, this is the 10-year anniversary of Black Maternal Health Week. And so, as we know, some of these things are still happening. There's still a need for this week. But I'd love to kind of hear your reflection over the last decade.
Yeah.
Is there progress that you're proud of? And also, where do you see the greatest urgency now versus 10 years ago?
Honestly, 10 years ago, when I would say things like it's racism, not race, that causes us to die, people, even Black people, looked at me like I had lost my mind. We believed, even if we didn't want to say it out loud, we still believed there was something about just being Black that we ate too much fried chicken, or we don't listen and don't follow instructions, and especially these loose black women. Y'all don't listen. Y'all always want to be in the club and be hot in these streets, right? So we blame black women so much for our birth outcomes. And so saying, no, 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 even white women go to the club too, and they eat fried chicken. So there's nothing magical about blackness that causes us to have poor outcomes. So now everybody says it's racism. So for in the beginning, when people looked at me like I was crazy, now it is a well-established fact that you can control for all the other things. And still, despite all those things, it's really the impact of believing that we are different, that there's no biological basis of race, that there is actually, but racism has a biological effect. And so people are not treated for their high blood pressure. So that it just, people are not treated when they're bleeding. They're more likely to allow them to not have access to all kinds of things just because we just don't value black people as human beings. And so that shows up in our criminal justice system. It shows up in all these other places, and maternal health is where it shows up. The other thing that has been a big accomplishment is doulas. In the beginning, we were just trying to get doula coverage. There were only 2 states that covered doulas on Medicaid. Now, it's in many, many states, it's not just on Medicaid, it's on private insurance now. The doula community has really coalesced and grown and created. There was a big debate about is it doulas versus midwives versus OBGYNs. We don't have to have that fight anymore. It's not a versus. We need all of it, right? This is not this is not versus on Instagram during the COVID pandemic. This is all of us together. We need more black OBGYNs, more black high-risk doctors, more black midwives, more black doulas. So we don't need to fight each other. So I think we're finally getting out of that kind of fighting and really investing in doulas and really highlighting as an OBGYN, as a black woman who knows that the history and legacy of Lucy, Betsy, and Anarcha, and the mothers of gynecology, and the importance of how we, as a field, decimated with midwifery in this country. And so being able to really invest in black midwives, we're seeing more black midwifery programs, more birth centers, more, just so many things. And the bill, the Momnibus, the Black Momnibus, was put together by black organizations across the country. And it's about $100 million investment into so many things like black midwifery. And so we keep trying to get it passed. And so hopefully this is the year that it's going to get passed.
Well, I'll tell you. So I'm in the Ohio State House, and in one of my committees, Children and Human Services, we are going through a midwifery bill right now. And one of the sticking points, right in my area, there's a birth center that has been set to open for quite some time, but couldn't get hospitals to sign the transfer agreements and, different things like that. And so you bring up the Momnibus Act. And I want to dig into that a little bit because I want to understand, what else should we be demanding from policymakers, from hospitals and systems, right now, right? Like, what are the pressure points that can actually lead to change? Because as you said, these bills are in legislatures or across the country. There's the Momnibus Act at the federal level. But what should we truly be demanding of these folks and systems right now?
I mean, I love, Root is one of the organizations I was on the board of. I don't know if you've ever heard of it. It's in Columbus, and they actually work on doulas in Ohio. But yes, so Ohio's been doing some great work, so I want to honor you and thank you for your work. And there are many states that have also done a state Momnibus, and this fight about control. So think about when we start saying that a midwife or a group can have their own birth center, that's taking money away from hospitals. So the hospitals are not being intellectually honest when they don't admit they want to have a labor and delivery, because they will say out loud in meetings in front of me and other physicians that they need a labor and delivery because although they lose money on it, women are the decision makers in the home. So obstetrics and gynecology is a loss leader, meaning that the hospital doesn't make money on the delivery of babies. But women take their husbands to the hospital for knee surgeries. Women take their daddies to the hospital for heart surgeries. So
Yep.
they want to keep
Yep.
the labor and delivery and keep us as payers, as a commodity, like it's buying bread at the grocery store. When what we are asking for is more birth centers, more things closer to home, more midwives, more access to doulas. And so when we keep saying the data and the requests or to have more things that are closer to our communities, and we're fighting a corporate giant like a hospital system, at some point, we have to start listening to what the people want and what the data shows, which is you are more likely to survive if you actually had community care in your community, like a birth center, with someone who knows you, who knows your community. Because birth is not this. My dad's an ophthalmologist, so you need fancy equipment to go in your eyes, and you need lasers. Having a baby is a beautiful, natural, physiologic thing. What you need is love and support to be seen and be valued, and then the ability to get transferred if there's a complication. As an OBGYN, that's my role. So if something happens bad, we should have a whole system that allows you to be able to get to that space. But to say you must come to my big hospital with all these bells and whistles as if that's what's going to save us, we keep proving that that does not work.
I'm with you. I will tell you, I am 1000% with you. I think the more options we have, especially what we're faced with when we are in those big hospitals,
Mhm.
if they can't guarantee guarantee our safety and our full well-being, then we should have more options of how we want to bring life into this world.
Yeah, and I'm
So,
sorry. Okay.
no, no, no.
During COVID, there was an uptick in home births. There was a lot of white women having home births. They were taking up the space. Black women have been doing it for a long time, and so people know that it's safe to have a home birth, and that we could create. In every other high income nation, people have home births, and so instead of us saying you must do what I say, which is not working because we have the worst maternal health outcomes in the rich world, why don't we
Mhm.
start listening to what the women actually want, and then make community around that?
Well, what a concept. We could have a whole other panel on listening to women.
About everything, about everything.
About everything, man. Well,
Elect black women, listen to black women.
oh my gosh, yes. So for the folks that are watching and here with us today, many of whom want to be a part of the solution. In this particular area, what does that action look like? I mean, how can people truly show up to support Black mothers and families?
Well, on the individual level, if you know someone who is pregnant, make sure that they are not going to their appointments alone. So often we feel like we have to just tough it out. Black woman, I drove my own self in labor when I had my son who only weighed a pound to the hospital. Looking back on that, it was not a good idea. But I had time for him. Right? So we have to stop that. And my daughter just recently had my first grandchild, and she drove herself to the
Oh,
hospital.
congrats. Oh my good.
We're just
See,
gonna have
two
to work
super
on
women.
right. We're gonna have to work on letting Superwoman die. Superwoman died. We're killing her. We need support. So if you know a black woman who is pregnant or wanting to become pregnant, I'll just another. Let me just pull back on that too. I was recently with the Funder Foundation at the AUC in Atlanta, and all these black girls were coming up to me asking about. I was asked a doc for the day, and they were asking about if they could get pregnant. So we are so worried about our ability to even become pregnant at this point. We have been the atmosphere around blackness is we're either hypersexualized or they think or girls think they cannot get pregnant. So really supporting black women in their journey around forming families, talking to each other as if you're girlfriends, if you're friends in school, if you're grown 50-something-year-old, 40-something-year-old women. I still have friends in their 40s who are still having babies, right? Really talking about what is your birth journey? What are you thinking about? What do you want to do? There's a range. I've had a baby every way from preterm through a gestational carrier. So we full range of ways that we can make families. And so really ensuring that we make room for listening to each other and making space for each other. So go make sure no one goes alone. And then when they are there, you can listen to their appointments. I do this with my parents as well, right? Like people try to go by themselves. You cannot be both the patient and the advocate at the same time. That's why doulas are so important because they do go and advocate for you. They are listening with you. But if you can't afford a doula, or take a sister friend, take a cousin, or take an auntie, but do not go by yourself. Because you cannot be both the patient and also the advocate. So that's a simple thing that people can do that has nothing to do with doing things like you, like running for office. We need more people in school boards. We need more people in the state house. We need more people who are actually making the policies. Things like paid leave don't have to be impossible. You can have paid leave in your city. You could say we're going to do a bond thing that says all because like in New Orleans where I'm from, we were trying to get that for birthing people because a lot of the mamas work in the hotels and the restaurants. People love to come eat our food and they flip in your beds and they have no paid leave, so they can't make any risk appointments. They can't make it when they have the baby. They have to come back to work within a couple of weeks. That is just not. That is a strategy for failure for creating poor birth outcomes. So the more we have people in city councils, state houses, the access to. We saw recently that in Georgia they're forcing people to have C sections. They're calling in courts, and so this whole like fetal personhood movement that we're having. We haven't even decided Black women are people, but we want to make the fetus a person and then not feed it when
Wow.
it
I
becomes a
mean,
real baby. So you
you're
know,
naming it.
so we got to really push back on this fetal personhood stuff, and until we can get some personhood about us, we have these states' rights versus human rights. We've been litigating that in this country since we were stolen from the shores of Africa. So it's time to get over that and really invest in that. We're not blaming and shaming Black women around abortion. Abortion is health care. Abortion just means, for us, when you're having a miscarriage, we don't use miscarriage, it's not a medical word, and
Right.
it's a different types of abortion. So we have now taken a word that actually has a real meaning and made it mean nothing. And
Nothing.
so
Yes.
we cannot let people, the same way they make socialism mean nothing, like there's some real definitions for these words, right? They're not just an
Right.
emotional feelings about what I'm doing when I have sex or when I want to make sure that we don't have people who are starving and can't get access to SNAP. So the more that you can see that all of those issues, climate change, as I mentioned, I'm from New Orleans, the whole like being a climate refugee is a real thing. And we see people from around the globe trying to make it to the United States, and we are being horrible to immigrants. Horrible is not even a strong enough word for that. So all those things are tied. Mass incarceration is tied. We have studies that show the higher your mass incarceration rate is, the higher your infant mortality rate. So just don't think of maternal health as an isolated issue. It is. We are all tied to each other. The devaluing of our bodies is all tied. So if you're a preacher and you want to pray for us about not having abortions and pray for our souls, but don't go and legislate that we can't have these things, because we get
Exactly.
things that happen right now where people are dying because they need having a miscarriage and people don't know what the word abortion means. So you start legislating. I don't try to pretend I'm a lawyer. I need people to stop pretending they're a doctor when they're in these state houses and
Or
talk.
pretending they're a woman. Because I'll tell you, and we can close this out. And I thank you, Dr. Joya, for your brilliance and the leadership that you've done towards this work. We are excited to be celebrating Black Maternal Health Week because of the visibility, right?
Yeah.
But not because of the fact that we need to make greater outcomes. But you are 1,000% right. In the Ohio State House, there was just a bill, and five men stood up on the floor talking about why we needed a 24-hour waiting period for abortions. Five men.
Exactly. And listen, and ask them to define what the word abortion means. Just say, can you tell me the way they keep saying divine a woman, define abortion. How about
Yep.
that? And I
Exactly.
need you to say,
Exactly.
we're going to look through your bills to see if you ever paid for one before you stand up again.
Hello. We'll see. And we can end on that. Thank you. Thank you. Thank you, Dr. Joya, for your brilliance and for joining us here with Sunday Brunch. And we'll get back to the program.
Thank you so much, the honor.